come in.
Hand hygiene. My name is Hannah Waits. I'm a student here at the College of Nursing, and today I'm going to be doing an abdominal assessment on you. Is that okay?
Yes.
All right, so I'm going to go ahead and get you to lay down. We're going to put you in the supine position, so you have a pillow, your arms are by your side, and your legs are bent. I'm just going to pull your pants down just a little bit. Now, before we get started, do you have any pain or tenderness in your abdomen, or do you need to empty your bladder?
No.
All right, so first I'm just going to start by inspecting your abdomen. So I know that the color of your abdomen is consistent with that of the rest of your body. You do also have some fine vellus hair above and below your umbilicus, and your umbilicus is inverted. Also, I don't note any scars, lesions, rashes, striae, or anything abnormal on your abdomen. So now I'm just going to move to, I'm just going to look at the shape and the contour of your abdomen. And I note that it is flat, and I don't note any palpitations, hernias, or peristalsis. So now we're going to move on to auscultation. So I'm just going to listen to your bowel sounds. I'm going to use the diaphragm of my stethoscope. Alright, so what I heard while I was listening to your bowel sounds was normoactive bowel sounds. So what this means is that your bowels, they occur 5 to 30 times per minute. They're very loud, high frequency sounds. They sound like cascading, they're almost like a gurgling sound. If I had have heard hyperactive bowel sounds, then these occur more frequently than normoactive bowel sounds. They're also very high pitched and loud. But these sound more like a rushing or like a tinkling sound. If I had have heard hypoactive bowel sounds, these occur less frequently than your normoactive bowel sounds, and they're a little quieter. And then if I had to determine if you had absent bowel sounds, then I would listen to your right lower quadrant for a full 5 minutes. So now I'm going to use the bell of my stethoscope. I'm just going to listen to your abdominal aortic artery, your renal artery, and your iliac arteries, okay?
Okay.
So I'm going to start with the abdominal aorta. All right, I'm going to get you to bend your elbows up. And for the renal, I'm just going to come in off your elbow. And for the iliac, I'm going to come off your iliac crest here. All right, so there were no bruits noted. Now we're going to move on to percussion. I'm just going to percuss your all of the quadrants in your abdomen and see what we hear. All right, so as I was percussing, all I heard was, I heard tympany throughout. There was a little bit of dullness, but this could be due to you having recently eaten, or even there being stool still in your bowel. And I will assess your CVA at the end. So now we're going to move on to palpation. First, I'm just going to start with light palpation. I'm just feeling for muscle tone and surface character, okay? And I'm only going to go about 1 centimeter. All right, so I noted that you had good muscle tone throughout your abdomen. So now I'm going to do deep palpation, which is going to be a 5 to 8 centimeters. And I'm feeling for any tenderness or masses. So just let me know if you feel any pain or tenderness. Okay. All right, did you feel any pain or tenderness?
No.
All right, so there was no tenderness and no masses noted. So now I'm going to palpate for your liver. So I'm just going to hold your ribs here. I'm going to have you exhale and then take a deep breath in. And just keep doing that. could not feel your liver, so your liver was non-palpable, which is normal. Now I'm going to assess your spleen, so I'm just going to hold your ribs, support your ribs here. I'm going to get you to inhale and exhale a couple times for me, okay? All right, and I wasn't able to feel your spleen. Did you feel any pain or tenderness there? All right, so your spleen was non-palpable, which is good. So I'm gonna have you sit up. Just put your back to the camera here. Now I'm just assessing for I'm percussing for any CVA pain. So I'm just gonna place my hand on the 11th or 12th rib, and I'm gonna hit the back of my hand, and you let me know if you feel any pain or tenderness, okay? Any pain? All right. No pain? All right, so there was no CVA pain or tenderness noted, and this completes my abdominal assessment for today.